All right, we shift gears from politics to health. The outbreak of cholera has recorded quite a number of fatalities. Lagos, for instance, has recorded 15. And that number has further increased the total number in the country to above 30 that was reported by the Disease Control Agency. We're being joined on the program by Abia, who is a public health expert and is the Assistant Director and Epidemiologist, Nigeria Center for Disease Control, as well as the Head Subnational Advocacy on Health Security and Health Promotion at the NCDC. Welcome to the program, sir.
Good morning. It's good to be here this morning.
So let's begin with what is the state of things as we speak. There are so many things being reported. So let's put facts to some of the things that we're hearing concerning the outbreak of cholera, not just in Lagos, but across the country, in terms of prevalence and those numbers.
Yeah, very good. To start with, as at 15th of June, the current statistics put it at 1,314 cases in the country. And of these, we have now reported about 31 deaths, slightly one above the initial figure. And sadly, Lagos has, like you said, 15 of these 31, that's like half of the dead burden. So when we look at these statistics, taking it further, there are top 4 states, so to say, that contribute to this, starting with Bayelsa with 442 cases. Lagos reported 350 cases. Abia, for instance, 109 cases. Let's say those top 3. The rest, like Zamfara, has about 64 cases. The rest are about less than 50 cases reported so far. So it's still 30 states that have reported, and that is very significant for us.
What is driving it? We seem to have a layman's understanding of what causes cholera, but this particular outbreak, what could be responsible?
All right, so it might interest us to have a bit of understanding about this organism that we're describing. Cholera is not new in the sense that as far back as the 15th centuries, cholera epidemic has been described. And in the last 2 centuries, for instance, there have been up to 7 pandemics that have occurred. I mean, when you describe pandemic, now we know what it means from the experience of COVID. So we've had about 7 pandemics, with the last one that started in 1961 and came into Africa in 1971. And since then, this organism has been around. So when we talk about cholera, we know that cholera is an acute diarrhea disease caused by the organism called Vibrio cholerae. Now, it's a bacteria. The particular characteristics of this organism made it so challenging to control, and that has been possibly responsible for the trend we've seen so far. And so, if you don't mind, I may delve a bit into microbiology, as basic as possible. One, this organism, if you have heard from the news, we talk about the characterization or the classification of this organism. I break it down a bit. We talk about the Vibrio cholerae that has serogroups. Those serogroups are classified based on the bacteria that has similar or common antigens. So we talk about almost 206 serogroups of this bacteria that exist. But beautifully, out of these 206 serogroups, only 2 are known to cause outbreaks. And that is the serogroup O1 and serogroup 0139. Now, for us, and in recent time, we've seen that it's the serogroup O1 that has been responsible for major outbreaks that has been reported. To break it down a bit further, you find that, and I want to deliberately do this so that people will understand why this organism will be with us for a longer time if we don't take proper measures. So we break it down further, we talk about the serotype and the biotypes. The biotypes specifically look at what are the other functional properties of this organism that gives it the ability to cause the damage it's causing. So we look at the functionality with respect to its virulence, its ability to produce toxin, and its ability to survive in the environment. I dwell more on this ability to survive in the environment. This particular bacteria, so we classify as one as classical, one as health, or those ones are just microbiology. But the beauty of it is that this organism has the ability to go into dormancy in the environment. So it can live in the environment for long period.
How long?
It can be there for as long as possible, as in like weeks, months, years.
Even years.
Yes. It has the ability to change its system to adapt its genome to any environment, whether it's a salty water, whether it's a fresh water, name it. Whether it's a temperature of 10 degrees, 40 degrees, it can adapt. It also has the ability to create what we call biofilms. Biofilms is a complex layers of bacteria that help to shield the organism from external stress, whether it's UV light or radiation, anything. So if you have such an organism that can survive in any form of salinity, in any pH level, an organism that has the characteristic that can weather any storm, so to say, let's put it that way. As soon as it leaves the environment, and this is how it continues to cycle, because the beauty of it is also that the human host is the only known living host for this organism. The rest are in the environment where the reservoirs are. So when this organism gets into the human host, it activates the system. And that is why it does its reproduction, the replication, and does the damage. So when it gets into the human host, for instance, it absorbs water back, activates its cellular functions. When it gets to its cellular function, it is, with the temperature in the intestine and the body system, is suitable for it to be able to reproduce. And so with that, it causes its damage, and the diarrhea that comes out of that is what releases more organism into the environment, and the cycle continues.
The beauty is now, I feel like, as you said, you've taken us through microbiology, so I need to get a certificate after this show. But it's beautiful how you explain it, so we know what we're up against. And I think that's one of the basic things of war: know your enemy. And in this case, it's Vibrio cholerae, as you said. But you know, someone wrote a very fantastic piece, Adebayo Adeyinka, and I think it's been trending, about how he was listening to some old music from Ebenezer Obey, and you know, and I think this is about 40, 30 or more years ago, and he was talking about how people this season, literally, then cholera was a major thing, and it was around this season where they were celebrating you know, the festival, you know, the Hajj. Maybe it's not related, but he just thought about it, that so we've had this for a long time, and it looks like it comes at this season, this rainy season. So WHO has said it's a disease of poverty. That alone is sad to hear, that we're still battling cholera. But how is it that we've not been able to map the trends, look at the data, look at the trends, and say, at this time, cholera is most definitely going to knock on our doors, so this is what we need to do, so we prepare ahead? Is that somewhere we dropped the ball? All
right, so permit me to bring this out, please. So this is what we called the emergency and disaster risk calendar.
Right.
This map is one of the things we came up with at the Nigeria Center for Disease Control, for instance. Having analyzed the data for our epidemics, our priority reportable diseases for more than 5 years, and we're able to establish the seasonality, the seasonal patterns of these diseases, including cholera. Now, we have an understanding, but the interesting thing about this bacteria is that because it's present like in an endemic state in some part of our country, where we describe as the hotspot state, they are always there. So around the year, you see that these cases are going to keep coming on. Cholera can occur any time of the year, but the surge happens during the rainy season. So when the rain comes, the fecal matter that are being put across the sewage and other places, the flood comes with it and washes it into the water consumption and food pathways. And when human beings get into these more, then it gives us the challenge we have in our hand at the moment. So we understand that this could happen. But sadly, there are a lot of issues relating to control of cholera that are not just health focused. There are those things that we describe as the social determinants of health that need to be put in place to help health sector to be able to accurately, let me put it that way, and precisely stop this outbreak. What are we talking about? The wash. We talk about water issues, sanitation issues, hygiene issues. These are not within the health sector purview, so to say. The ministries, departments, and agencies of government responsible for sanitation, for maintaining hygiene in our environment, ensuring proper waste disposal, have their responsibility to work with us to ensure that we can stop this menace. And like you rightly said, this is a disease that is associated with poverty. You find it in slums, in dirty environment, where there is poor access to hygiene, to water, and all sorts. So when you have such environment, and you have it in every part of the country. Sadly, the current outbreak in Lagos, the highest number of cases were reported from Lagos Island. All right.
Is there a reason for that?
Well, the factors we mentioned about, if you look at it closely, you most likely find those slums in those parts of the, of the local government where the bacteria can thrive. And when it thrives there, what are some of the issues we look about? What is the personal hygiene issues with the people? What is the environmental hygiene of the people? What is the food hygiene of the people? You know, there is this nonchalant attitude about what we consume at times, or the environment is prepared, people are ready to go on. And luckily for us, we've not really seen the actual burden of this disease, because most of us, some immune system have been able to help us overcome it, and no thanks also to the over-the-counter medicine that people will just go and grab their antibiotics at any slight abdominal upset, and they don't really understand what that has caused. And so when we have this situation in our hand, it becomes worrisome, because to control such, or to put an end to it, and that is why even globally, they're not talking about eliminating it yet. We have a global task force for cholera control, because it's a disease, I mean, like I described the organism, it is prevalent in the environment, and so, especially for those states.
You know, Carl, this question is instructive.
Okay.
It's instructive, you know, because this didn't just happen upon us. As far back as 2022, there had been reports of cholera outbreak, and if you check some statistics, it says that there had been about 3,000 cases reported between 2022 and 2023 alone. And I see in one of your reports on the outbreak, a recent one, by the way, dated 13 June 2024, that there's a small portion that is subtitled Advice to State Government. NCDC continues to advocate to state governments to prioritize action for solutions that ensure access to and use of safe water, basic sanitation, proper hygiene, and it continues like that. The question is, how strong is the mandate, particularly maybe contained in the laws establishing the NCDC, for advocacy and advice to state governments to provide the infrastructure required to check the spread of cholera outbreak and to encourage preparedness, you know, for other types of epidemics in the near future? And if there is no commensurate response to the level of danger that we find ourselves in, what also is in the core mandate of the NCDC, you know, in terms of action to let them know the emergency that we find ourselves in?
Very good comment there. So let me start by saying that before I talk about what the state is expected to do with respect to our mandate, at the end of every outbreak season, like for instance the last year, we conduct what we call the after action review. This after action review helps us to understand what are the barriers, what are the challenges, what are the best practices in the just concluded outbreak season. The lessons learned from it, the challenges identified were used to develop a preparedness plan for the next season. And some of the activities we carry out ahead of the next season include training of the local government rapid response team. We support the state to ensure that their rapid response teams are trained. We preposition supplies that are relevant for managing these cases when they occur. By the way, I tried to mention earlier on that even globally, they're not talking about eliminating cholera yet. We're talking about controlling it. So it will happen. And they are looking at, even globally, the target is that let's reduce the case fatality, meaning we want to reduce the mortality to less than 1%, because it will always come. So but let's ensure that we reduce it to the barest minimum. So we preposition these supplies, and as I speak to you, across the states in the country, supplies are ongoing. In addition to that's like a top-up to the ones we gave before the season started. Aside that, we provide this advisory that you mentioned. So it's for the NCDC to say, this is what we have predicted, just like NIMET will come and say flood will happen. It's now left for the respected states to take up this responsibility. Sadly, the part of the law does not enforce, does not come with the enforcement.
So there's nothing the NCDC can do if the subnationals do not respond? The current mandate
does not give us that. And maybe that's one of the things that could go into the review of the policies and the laws of the government. But for as much as possible, we don't really feel it should be about forceful engagement or penalties and all that. If we first explore, that would be the last option, so to say, if it ever occurs. But at least let's look at that engagement. And that is happening already with the Nigerian Governors Forum. We have the head secretariat of the Nigerian Governors Forum that we are talking with. And they have, initially they used to have immunization, universal health coverage, nutrition on their plates that they're really tracking. But now we've worked with them and they are considering putting health security. So component of health security will help ensure that they can put in some additional resources to tackle health security related issues, which this particular institution comes in. So going forward, at our own level too, there are other support that they will give to this, given to the state from the global, from the World Bank, from Global Fund, and all that to help and support their system, because we know that the issue of health security is really something so overwhelming. So what we are looking at is we understand the limitation with economic challenges in the country and all that. So the state governments are trying their best, so to say, but we are just encouraging them. We are appealing to them to do more. But like I said earlier on, the issue of response to cholera goes beyond just the government. The private sector needs to come up. The non-governmental organization, just like international partners are doing to support us to come to our rescue, they are doing their best. So let's look within also to see how we can mobilize relevant resources. But
before the private sector comes in, what about publishing reports to show areas that are in serious deficit where WASH is concerned? For instance, in some areas, there are the slums that you mentioned, there are no toilets, there is evident open defecation in canals, in bush parts, which portend serious danger on the highway.
If I may both you in there, Nigeria as a country has a goal, a target to end open defecation by 2025. I mean, when we say
next year, by the way.
That's next year. When we say open defecation free nation. But as at last December, only Jigawa State, out of our 36 states, can declare an open defecation free state across all these LGAs. So in total, we had about 118 or 117 local government areas out of our 774 that are open defecation free. And that's a meager 15.1% of our local government areas that are open defecation free. So you can imagine. So as long as open defecation is still the practice going on, what are the things we need to look at? The housing structures or the relevant agencies responsible for this need to help ensure. UNICEF gave a very not really worrisome, a very staggering figures of the number of toilet facilities that are required for homes in Nigeria, for healthcare facilities, for public spaces that need to be put in place for us to be able to achieve this target. So these statistics are there, and what we are really looking at is that how can, whether government, whether all the relevant sectors, because it's beyond what, okay, like for instance, talk about millions of toilets. I think about 20 million from UNICEF recommended for us to address our more than 220 million population, cater for them with respect to toilet facilities, because it's of no use. If you tell me not to defecate openly, but there are no toilet facilities for me, I will make use of, human beings. It's a normal physiologic process. If I am pressed, I need to find something to do to my system. So one of the things we are recommending is, how do we come together? We call it an all-of-society approach to this issue. It's an all-sector approach, sector-wide approach, which is in line with the mandate of the Federal Ministry of Health, to see that we bring every relevant stakeholder to the table and address this concern. And one of the things we are doing going forward, like tomorrow, we are having a dynamic risk assessment to also assess the vulnerability of other states with respect to the risk this outbreak poses to them, vis-a-vis their ability to cope. Their coping capacity, we want to see with respect to human resources, with respect to laboratory capacity for diagnosis, and other relevant things that are required, that if this continues at this rate, we don't want to record more casualties. So following that assessment, we are expected to activate what we call the incident management system, a command structure that helps coordinate all this response across all the states, put all the resources, pull the resources from relevant partners together, and see how we can support the state in this regard. And I tell you, the Nigerian Governors Forum is open to this conversation, and they are willing to support.
Well, being open is one thing. Action, result is what we're looking for at the end of the day. That's when we really see that things are done. We hope that will be done. But let's speak to the issue of hygiene.
Great.
Motor parks, food vendors around, because why I raise that question is, the well-off, the haves in society, if they are sick, except it's something that medicine cannot cure, they have the resources to go to hospital and take care of themselves. But these ones are already poor. And so if they get exposed to this situation, death is almost inevitable. So what can be done at the very local level? Because that's where governance should really start from. Vendors in local places where we go and eat a wagon and all of these places, and at motor parks and all of that. What can be done? Because those are the specific targets we should be looking at first.
Absolutely. So when we look at the levels of interventions, it could be at individual level, it could be at community level, before we talk about the government structures. So at individual levels, we talk about maintaining our personal hygiene. During COVID, we talk about taking responsibility. Everybody needs to take responsibility for their health as much as possible to start with. Meaning, if you have to access such food joints, physical assessments could even suffice to see whether that environment is hygienic enough. You see places where food vendors are by the gutters, like sewage lines, and you see flies around, and you're comfortable to sit and take a meal for such. Two, we're looking at how people will inculcate this personal hygiene. Now, hand washing is something that has been proven over time that more than 60% of infections can be controlled just by proper hand washing. Now, if we inculcate that habit, okay, the food vendors you mentioned about, you talked about, there is what we call the food handlers test that are expected to be carried out for anyone who desires to provide service with respect to food, consumables for human beings. And so we help them to know whether they are also carriers of these organisms themselves and all that can potentially transmit to human beings. Now, at that level, there are basic efforts that can be put in place to ensure that every home have access to toilet facilities. Now, in my concluding thoughts on that point, I don't know how much time we have more.
10 seconds.
In my concluding thoughts on this, I just want to put on the record that prevention is the key.
It's cheaper.
It is not only cheaper, it's also the most effective way of managing this crisis.
Just to see that, by the way, we're still in the moderate season. We have not even gotten to the high or the peak. Just said July, August is a peak for cholera.
Let me add this.
No, I just wanted to
when the rains come with greater intensity,
exactly.
right?
So
the flood will keep coming, and NIMET has predicted that we should expect more. So in this regard, let us understand the also contribution of climate factors, the climate changes that are also distorting. That is also distorting this analysis.
All right.
And so the best bet is to see how we can prevent this.
We must thank you, Mr. Abiodun Oguni, Assistant Director and Epidemiologist, Nigeria Center for Disease Control. You're also the head Subnational Advocacy on Health, Security and Health Promotion of the NCDC, lead National Rapid Response Team on Cholera for Lagos. We hope we can contain this and reduce the fatality number. We must thank you for coming.
We keep doing our best, and we trust Nigerians to cooperate and support us. For us at the Nigerian Center for Disease Control, we are committed to protecting the health of Nigerians.
Absolutely. All right, we'll switch gears when we come back after this break to the creative industry, the creative space. Join us again.